Morning everyone. Hope you're finally enjoying a little bit of the sun that we're seeing. Just getting my weekly hack in before it gets a little bit too hot later on. Sorry it's been a bit quiet. It's been a little bit mental on my end, traveling lots and keeping busy. I've been asked quite a bit recently. I've done a few lectures around breaking down laser therapy devices and trying to understand a little bit more about the devices and, why is there so many mixed reviews? Why is one laser better than another, etc. So what I wanted to do is do a little bit of a video series where we break down laser devices and also look at some of the myths around laser, try and hopefully put a bit more education out there from fact, and hopefully try and get rid of some of those misconceptions around the therapy. Now, I want to look at components that make up a laser. I think it can be quite complicated to understand exactly why a laser works. And again, if you speak to tons of different companies, it can be easy to get a bit confused as to, okay, why is this laser better than the other? And I don't want to be biased, so this isn't a bias towards any laser, as this is purely these are the facts that we know we need these elements to have an effective laser. So I'm going to break it down. I'm gonna do a series of videos and kind of literally just look at one element per video, so we'll keep it quite simple. I'm also going to introduce my new theory, and this is my train theory. And again, if you're like me, I need visual representation to kind of make things make sense. So to hopefully get rid of some of the confusion about, okay, what does this actually mean when we put it all together? I'm going to talk you through my new train theory. Those of you that have listened to me lecture recently might have heard me kind of talk about this, so apologies in advance if you have, but I do think it's important to have something to help us understand. So the first bit I'm going to look at is class of laser. So through these series of videos, I'm going to look at all the elements, like I say, so class, wavelength, kind of dosing, characteristics of the patient, irradiance, etc. And all these elements make up a laser. So there isn't one bit that is more important than the other. We've got to have the right soup, if you like, or the right train and the right train tracks to get to the station we're trying to get to. So that's a really important first thing to say, is not one element is more important than the other. Now, depending on what you're trying to do with the laser, then in some circumstances, some parts are a little bit more important to have right than the others. But again, I'm going to try and break this down to make a bit more sense for you. So the first element is looking at class of laser. This one's quite an emotive one. I always talk about it being the class wars, because we always talk about class quite a lot and focus quite a bit around that. And yes, it's absolutely important for what you're trying to do, but I think we get a little bit too stuck around this element. So let's break it down. So class of laser relates to two things: power of the device and what are the health and safety implications because of that. So typically we see class 1, class 2, class 3 and class 4 lasers. Now, again, this is one element, so we shouldn't be kind of just looking at this. So our class 1 devices are kind of up to 0.05 milliwatts. Our class 2, 0.01 milliwatts, our class 3B up to half a watt, and then our class 4 over half a watt of power. Now, what's really important about class 4, though, I will say, is that just because something's class 4 doesn't make every class 4 equal in their power, because actually you can have a 1 watt laser, a 5 watt laser, a 10 watt laser, or a 25 watt laser. All of those are technically class 4, but the power is actually very, very different. So this is another reason we can't just go, okay, I have this class of laser, it's perfect. We have to kind of really understand our lasers a little bit more. So our class 1 and class 2 devices, like I say, they're lower powered. They are, from a health and safety point of view, they don't have any risk to eyes, and generally don't have any thermal risk either. So very, very safe to use. The challenge with them is, as their own, just a class 1, the difficulty is getting enough power to saturate enough tissue. And again, this is one element. There are lots of other elements that can make or break kind of whether the laser is effective or not. And it again depends on what you're trying to treat. You know, are we trying to treat superficial, or are we trying to treat deep? Are we trying to cover a large tissue area or only a small area? So that would be our class 1s and 2s. Class 3B is, like I say, up to half a watt of power. From a health and safety perspective, it is recommended for eye protection, but not absolutely compulsory with some devices. So just because it's 3B doesn't mean you don't have to wear eye protection, or you do. You need to check with your manufacturer's recommendations on that. But again, like I say, from a power perspective, it's up to half a watt, and it may generate some mild heat, but not intensively. And then we have our class 4s. So like I say, that's anything over half a watt. So it's important to really understand the wattage that you are working with. And then with that, health and safety wise, we do have to wear eye protection, and we do have to make sure that we're using our laser safely, so that we don't generate kind of excess heat and potentially cause any damage. Now, that's not to say that class 4 is so dangerous we shouldn't be using it. Absolutely not. I mean, I've used class 4 for kind of 10 years. Work with many people that have, and they are safe and effective as long as they are used properly. It's like any tool that we use in rehab, in the vets. It's all about training. It's all about using it properly, and they are absolutely safe to do that. Now, again, depends on what you're trying to treat as to how much power, and you'll see as I go through these videos that everything links together. So we can't just say, okay, I have kind of this class of laser, this power of laser, it ticks every box. But what is important is the power does relate to the irradiance level, and I'll talk about irradiance in one of the other videos. And that essentially is the brightness of the light. So again, it's important we understand the condition that we're treating, and kind of understand, again, the power of laser we have as to how much irradiance we need to be effective as well. But I'll cover that, like I say, in a bit more detail in another video. As for my train theory, so my train theory is every element of a laser will make up part of our train. So power is the coal in the train. So depending on how much power we have, depends on how much coal we have in our train. Now, obviously, we can keep shoveling in coal as we go, because obviously when we turn our laser on, it doesn't just stop producing light. But our coal bin is a bit smaller in our lower powered devices. Then in our higher powered devices, we might have a bigger coal bin, so it will hold a bit more. So that's my first element of my train, and I promise it will make sense more as we go along through these videos. So I hope that kind of made a bit of sense. Please feel free to kind of ask me any questions around this part, and stay tuned for the next section where we'll talk a little bit about wavelength, and the importance of the wavelength, why it's important, and where it relates to our train. So I hope that helps understand a little bit more about the power of our lasers.